Hello everyone. Today in the series of Docplex's KOL interviews, we have with us Dr. Lilly Rodrigues, who is a consultant physician and diabetologist from Hyderabad and is the Joint Organizing Secretary for IDEC Pune. Dr. Lilly, thank you for being with us. So, starting with the interview, firstly I'd like to know what was the topic for today.
My topic was on women, diabetes and women, and all the aspects of all the various aspects that a woman goes through in her life, right from adolescence to the middle age, the reproductive age, and then the postmenopausal period. So I was part of that symposium, or rather a workshop, and my topic was gestational diabetes and type 2 diabetes.
Okay, talking about gestational diabetes, I'd like to know how serious is the epidemic of GDM?
Yeah, it's very serious now, and particularly in India and the entire Southeast Asia. Right now, almost 10 to 15% of women who are pregnant are diagnosed to be gestational diabetic. So that is how serious it is. It used to be just hardly known earlier, and over the last 10 years it has become almost 10% for sure.
Okay, so moving forward, how many of GDM mothers go on to become type 2 diabetic?
Yeah, that is a very good question. The type 2 diabetes is a very serious issue in the GDM mothers. In the end of the first year itself, it's about 20 to 30% become type 2 diabetic, and by the end of the 10 years, it is said that about 70% of the GDM mothers are already diabetic, particularly in India.
Oh, that's great number.
Yes.
Okay, so what key message would you like to give to the mothers?
The mothers have to listen to the doctor's advice, and the doctors will definitely tell them that at the end of the 6 weeks see what happens is every mother after the delivery, the good baby is born, and then well baby, and then they are very happy with that and they forget about the gestational diabetes. Yeah. So they are supposed to follow the lifestyle of a diabetic person throughout her life from the after the delivery, because a gestational diabetic woman would definitely sometime in her life become diabetic. So she has to postpone the occurrence of type 2 diabetes, and she is asked to follow up at the end of 6 weeks with the oral glucose tolerance test. And in a study done in North India, for instance, at the end of 6 weeks, almost 29% of them had either impaired fasting glucose tolerance or impaired postprandial glucose tolerance, or overall both, diabetes, and 6.8% were already type 2 diabetes. They continued to be type 2 diabetic. So diabetes can be prevented, and if they are very careful, they should follow the diet, follow the exercise, and follow the instructions of the doctor.
Thank you so much, Dr. Lilly, for having this discussion. It was quite insightful, and I hope it helps the mothers and our community. Thank you so much.
Thank you.